Chapter 22, Safety for Sterile Processing. We begin our comprehensive study of Chapter 22 by acknowledging the fundamental reality of our professional environment. Sterile processing is, by its very nature, an industrial setting hidden within a healthcare facility. It is not a standard office job, nor is it a passive role. It is a high-stakes technical field where technicians face serious and distinct risks every single shift. These risks are not random. They generally fall into four primary categories that will structure our learning in this chapter. We face biological hazards from our constant exposure to blood, tissue, and body fluids in the decontamination area. We face chemical hazards from the potent sterilants and high-level disinfectants required to kill microorganisms. We encounter physical hazards, such as burns from steam sterilizers and cuts from sharp instrumentation. Finally, we deal with ergonomic stressors caused by the repetitive motion and heavy lifting required to process surgical trays. The ultimate goal of this chapter is to help you establish a personal and departmental culture of safety. A culture of safety is defined as an environment where employees are fully aware of these inherent risks and feel empowered to prevent accidents before they occur. Safety in the Sterile Processing Department, SPD, is a shared responsibility. While facility management is legally obligated to provide the necessary tools, such as personal protective equipment, PPE, safety data sheets, SDS, and ongoing training, the technician must make the conscious decision to utilize these resources correctly. It involves a mindset where, if you observe an unsafe condition, you understand that you have both the authority and the obligation to speak up to prevent harm to yourself, your colleagues, or your patients. We now move to the critical concept of risk management. In the context of healthcare operations, risk management is defined as the systematic analysis of potential hazards and the implementation of specific procedures to minimize injury and legal liability. It is a proactive approach to safety rather than a reactive one. A central component of effective risk management is the protocol for incident reporting. You must understand that any workplace injury or accident, no matter how minor it may seem, must be reported to a supervisor immediately. This includes everything from a needle stick or a chemical splash to a back injury or even a minor paper cut from a corrugated box. Immediate reporting is non-negotiable for two primary reasons. First, it ensures that the facility can provide necessary medical treatment to you without delay, documenting the exposure for your long-term health protection. Second, it allows the department to take corrective action to prevent the incident from happening again to another employee. Employers track these incidents using an official government record known as the OSHA 300 log. This log is used to track work-related injuries and illnesses, allowing regulatory agencies and safety officers to identify trends and areas where additional training or engineering controls are required. By reporting an incident, you are not admitting defeat. You are contributing to the data that makes the department safer for everyone. Having established the importance of internal reporting, we now broaden our scope to the external regulatory bodies that govern these safety protocols. The primary federal agency dedicated to workplace safety is OSHA, the Occupational Safety and Health Administration. For your certification exam, it is vital to distinguish the role of OSHA from other agencies like the FDA or the CDC. While the FDA and CDC primarily focus on patient safety and public health protocols, OSHA regulations are designed specifically and exclusively to protect you, the worker. If a regulation addresses the safety of the air you breathe in the decontamination area or the protective gear you wear, it is an OSHA standard. Under the authority of OSHA, one of the most significant regulations you must master is the Hazard Communication Standard, commonly referred to as the Right to Know Standard. This standard is built on the principle that you have the legal right to know exactly what chemical hazards you are exposed to during your workday and how they can affect your long-term health. Employers are legally required to communicate these hazards clearly to their staff. Central to this communication is the Safety Data Sheet, or SDS. In older documentation and exams, you may see this referred to by its former name, the Material Safety Data Sheet, MSDS, but SDS is the current global term. An SDS is a standardized document that must be readily accessible for every single chemical used in your department, from the enzymatic detergents in the sink to the high-level disinfectants in the soaking bins. The definition of accessible is strict. These documents must be available to all employees 24 hours a day, 365 days a year. They cannot be locked in a manager's office or stored on a password-protected computer that you cannot access during a night shift. Each SDS contains critical details including the product's chemical ingredients, health hazards, safe handling and storage requirements, and the specific personal protective equipment needed to handle it safely. Most importantly, the SDS lists first aid measures and spill cleanup procedures. A key procedural point to remember is that if a chemical exposure occurs, such as a splash to the skin, you should consult the SDS either while you are administering first aid or immediately after to determine specific medical treatments. Finally, we must address the critical rule regarding chemical labeling. OSHA requires that all chemical containers be clearly labeled. This is straightforward for the original bottles you buy from a supplier, but the risk arises when you transfer chemicals. If a chemical is transferred from its original container to a secondary container, such as a spray bottle or a soaking basin, that secondary container must be labeled with the chemical name and appropriate hazard warnings. For your exam, you should also be familiar with the standardized color codes often found on these labels, such as the NFPA diamond. Blue represents health hazards, red represents flammability, and yellow represents instability. You must never use a spray bottle filled with an unknown liquid. If you encounter an unlabeled container, do not use it, report it and ensure it is disposed of properly. With the regulatory foundation laid, we now transition into the specific operational dangers found in the department, starting with general physical hazards. The first major physical risk you will encounter involves thermal burns. You must be acutely aware that steam sterilizer carts can reach extremely high temperatures, often exceeding 270 degrees Fahrenheit, immediately after a cycle concludes. The metal structure of the cart retains this intense heat for a significant period. Burns can also occur from touching the hot inner chamber of an autoclave during loading or from the heating elements of heat sealers used in the preparation area. To prevent these injuries, the safety protocol is strict. You must always use heat-resistant gloves, not standard latex gloves, when handling recently processed loads. Furthermore, hot carts should be pulled to a designated low-traffic area to cool, preventing passing staff from accidentally brushing against the scorching metal. The second physical hazard involves cuts and abrasions. These injuries frequently result from handling sharp instruments, broken glass ampoules, or even brushing against the sharp metal edges of storage racks. We must also note the specific hazards in the supply receiving and breakout areas. Utilizing box cutters and handling corrugated cardboard boxes creates a frequent risk of cuts and respiratory irritation from paper dust. In the decontamination area, the risk is heightened by sharps that may be hidden in instrument trays returned from the operating room. To mitigate this, always handle sharps with extreme care. A critical concept for your exam and daily safety is the use of a neutral zone. This is a designated area, often a magnetic mat or basin, used to place sharps so that the surgeon and scrub technician, or the SP technician, do not pass them hand to hand, preventing accidental cuts during transfer. Additionally, when sorting trays in decontamination, use forceps or sponge sticks to separate items rather than reaching blindly into a tray with your gloved hands. We also face the constant risk of slips and falls. The decontamination area is particularly prone to wet floors due to splashing from manual cleaning sinks and the drainage from cart washers. To prevent falls, you are required to wear non-slip shoes with closed backs and toes. Spills must be cleaned up immediately, and wet floor signs should be deployed to warn others of the hazard. Electrical safety is another component of physical hazards. You will encounter numerous electrical devices, from heat sealers to computer terminals. The golden rule here is simple: if a power cord is frayed or a plug is cracked, do not use the device. Do not attempt to fix it yourself with tape. Instead, take the item out of service immediately and tag it for repair by the biomedical engineering department. Now, let us examine a critical exam topic, ergonomics. Ergonomics is defined as the science of fitting the work to the worker. Its primary goal is to prevent musculoskeletal disorders, MSDs, which are injuries to the muscles, ligaments, and tendons caused by repetitive motion, awkward postures, or excessive force. In sterile processing, common stressors include lifting heavy instrument trays and prolonged standing on hard floors. To combat standing fatigue, anti-fatigue mats should be used at workstations. Regarding lifting, there are precise guidelines you must follow to protect your spine. When lifting heavy items, always lift with your legs, not your back, and keep the load close to your body to maintain your center of gravity. Crucially, avoid twisting your torso while lifting. If you need to turn, move your feet instead. Industry standards, such as those from AAMI, recommend a maximum weight limit for instrument trays, typically 25 pounds, to reduce this strain. Transporting items presents its own ergonomic challenges. When moving heavy case carts, the rule is absolute: it is safer to push a cart than to pull it. Pushing allows you to use your body weight and maintain better body mechanics. Finally, we must consider storage ergonomics using the concept of the power zone, which is the area between your waist and your chest. Heavy items must be placed on these middle shelves to allow for safe lifting without bending or reaching, while lighter items should be stored on the higher or lower shelves. Moving deeper into the technical safety requirements, we will now focus on chemical hazards. When working with the toxic substances required for sterilization and disinfection, OSHA establishes specific legal limits to protect your respiratory and systemic health. To pass your exam, you need to understand 3 key acronyms used to measure chemical exposure. The first is the PEL, or permissible exposure limit. This is the absolute maximum amount or concentration of a chemical that a worker may be exposed to under OSHA regulations. It is the legal ceiling that cannot be exceeded. The second acronym is TWA, or time-weighted average. This calculation represents the average airborne concentration of a chemical to which a worker is exposed over a standard 8-hour workday. It calculates your exposure as if it were spread out evenly over your entire shift, ensuring that your total daily intake of the chemical remains within safe bounds. The third is the STEL, or short-term exposure limit. This is the maximum concentration to which workers can be exposed continuously for a short period, typically defined as 15 minutes, without suffering irritation or chronic tissue damage. You can think of the STEL as a safety limit for accidental spikes in exposure during specific tasks, such as changing a sterilizer cartridge. Let us apply these concepts to the specific hazardous chemicals found in sterile processing. The first is ethylene oxide, often abbreviated as ETO. This gas is used for low-temperature sterilization of heat-sensitive instruments. While highly effective, it is extremely dangerous. ETO is a toxic gas and a designated carcinogen, meaning it is a known cancer-causing agent. It also poses a reproductive hazard. Because of these severe risks, facilities using ETO are required to perform specific routine air monitoring to ensure levels remain below the permissible exposure limit. Furthermore, you must understand the physical hazards of the gas cylinders themselves. Compressed gas cylinders must always be secured with a chain or strap to prevent tipping, and protective caps must be in place during transport to prevent the valve from breaking off. There is also a specific physical hazard associated with ethylene oxide called polymerization. Polymerization is a molecular reaction that forms a solid, sludge-like substance. If ETO leaks or spills, it can polymerize, creating a sticky residue that obstructs piping or equipment. For your exam, if you are asked to identify the sludge-like substance associated with sterilization hazards, the answer is the polymerization of ethylene oxide. The second chemical of concern is glutaraldehyde. This liquid is used as a high-level disinfectant for semi-critical items like endoscopes. The primary risk with glutaraldehyde is that it creates noxious fumes that can cause severe respiratory irritation and occupational asthma. To work safely with this chemical, it must be used in a well-ventilated area. The standard requires a minimum of 10 air exchanges per hour in rooms where it is used to constantly flush out the fumes. Furthermore, soaking bins containing glutaraldehyde must always be kept in covered containers to prevent fumes from escaping into your breathing zone. It is also vital to remember that chemical safety extends to the patient. Failing to thoroughly rinse these disinfectants from instruments can cause severe chemical burns to patient tissue. Given these chemical risks, we must discuss the requirements for emergency eye wash and shower stations, which are your first line of defense if an exposure occurs. According to ANSI and OSHA standards, an eye wash station must be located within 10 seconds of travel time, which is approximately 55 feet, from the area of potential chemical exposure. The path to the station must be unobstructed. You cannot have carts or boxes blocking the way. If a chemical splash occurs, the usage protocol is specific. You must flush the affected area, whether it is your eyes or skin, continuously for a minimum of 15 minutes. The water provided by the station must be tepid, which means it is legally required to be between 60 degrees and 100 degrees Fahrenheit. Water that is too hot will damage the eye further, and water that is too cold will prevent you from flushing for the full 15 minutes due to discomfort. Regarding maintenance, eye wash stations must be tested weekly. This weekly activation serves two purposes. First, to verify that the unit is operating correctly with proper water flow, and second, to flush out any stagnant water or sediment that may have accumulated in the pipes, ensuring the water is clean when you need it. We now shift our focus from chemical risks to the biological reality of our profession. Biological hazards are a constant presence in the sterile processing department because technicians are responsible for handling instruments contaminated with human blood, tissue, and body fluids. This creates a significant and daily risk of exposure to bloodborne pathogens. The three primary pathogens of concern that you must know for your exam are HIV, hepatitis B, and hepatitis C. To manage this risk and protect workers, the department operates under the strict authority of the OSHA Bloodborne Pathogens Standard. This federal regulation mandates that employers develop a written exposure control plan designed to eliminate or minimize employee exposure to these hazards. A critical component of this standard is the requirement regarding the hepatitis B vaccination. Because hepatitis B is a serious liver disease that can be transmitted through blood, your employer is legally required to offer you the hepatitis B vaccination series at no cost. It is your choice whether to accept it. If you choose not to take the vaccine, you are required to sign a formal declination form stating that you understand the risks. However, it is important to know that you can change your mind at any time. If you initially decline the vaccine but decide months or years later that you want it, the employer must still provide it to you free of charge. The foundation of our daily biological safety is the concept of standard precautions, which is also sometimes referred to as universal precautions in older texts. The rule is simple and absolute. You must treat all human blood and body fluids as if they are known to be infectious. We do not guess which patient has an infection and which does not. We treat every single tray and every single instrument with the highest level of caution. This mindset dictates how we handle items in the decontamination area. A major focus of standard precautions is managing aerosols. Aerosols are tiny, often invisible droplets of water that can carry bacteria and bloodborne pathogens into the air. Once airborne, these pathogens can be inhaled or land on exposed skin and eyes. In the decontamination area, aerosols are frequently generated during manual cleaning. To prevent aerosolization, you must always scrub instruments completely under the surface of the water. Scrubbing instruments in the open air is a major safety violation because it sprays contaminants into the breathing zone of you and your coworkers. Finally, sharps safety is strictly governed by these biological standards. Sharps, such as scalpels, needles, and glass ampoules, present a dual risk, a physical cut and a biological infection. Therefore, they must be disposed of in specific containers. These sharps containers must meet strict criteria. They must be closable, puncture-resistant, leak-proof on the sides and bottom, and color-coded red or labeled with the universal biohazard symbol. You must never reach into a sharps container for any reason, even if you dropped something by mistake. Furthermore, you must never manually recap a needle, as this is the most common cause of needle stick injuries. Regarding maintenance, when a sharps container is approximately 2/3 to 3/4 full, it must be sealed and replaced. You should never attempt to force items into a full container, as this increases the risk of injury. Having addressed biological hazards, we now move to fire safety. Understanding fire safety begins with the concept of the fire triangle. For a fire to occur, 3 specific elements must be present simultaneously: fuel, which is something to burn; oxygen, which is needed to sustain the fire; and an ignition source, such as heat or a spark. In a hospital setting, fuel can be found in surgical drapes, plastics, or paper wrappers. Oxygen is prevalent due to anesthesia support in the operating room. Ignition sources often come from lasers or electrosurgical equipment. The primary strategy for fire prevention is keeping these 3 elements apart. If a fire does start, extinguishing it involves removing at least one of these 3 elements. You must memorize 2 critical acronyms for fire response: RACE and PASS. The acronym RACE outlines your general plan of action when you discover a fire. R stands for rescue. Your absolute first priority is to remove patients and personnel from the immediate danger area. A stands for alarm. You must activate the fire alarm and call the specific emergency code for your facility to alert the fire department. C stands for contain. You must close all doors and windows in the area. This step is critical because it contains the fire and, more importantly, stops the spread of deadly smoke to other patient care areas. E stands for extinguish. You should attempt to extinguish the fire only if it is small and you can do so safely; otherwise, you must evacuate. If you decide to use a fire extinguisher, you follow the PASS acronym to operate it correctly. P stands for pull. You pull the pin on the extinguisher handle to unlock it. A stands for aim. You must aim the nozzle at the base of the fire, not at the top of the flames, because you need to hit the fuel source. S stands for squeeze. You squeeze the handle to release the extinguishing agent. The final S stands for sweep. You sweep the nozzle from side to side to cover the entire area of the fire until it is out. Finally, we address waste management, specifically the critical distinction between general trash and regulated medical waste. Regulated medical waste, often called biohazard waste, must be placed in red bags or containers marked with the biohazard symbol. However, it is a common misconception that every dirty item goes in a red bag. Red bags are legally reserved for items that meet specific criteria. They must contain liquid or semi-liquid blood or other potentially infectious materials. They must be items that would release liquid if compressed or squeezed, or they must be items caked with dried blood that could flake off during handling. This is a frequent exam distinction. Lightly soiled items, such as paper wrappers, gloves, or surgical towels with a small spot of blood, do not qualify as regulated waste and should be placed in the general trash. Proper segregation is vital because treating regulated waste is expensive, and improper disposal wastes the facility's financial resources. In addition to regulated medical waste, we must also properly manage hazardous waste in the chemical sense. In the hospital context, hazardous waste refers to substances that cannot be disposed of in the facility's normal trash system due to their toxicity to the environment or public health. This category encompasses chemotherapy agents, bulk chemicals, and radioactive waste. These items often require specific segregation methods to prevent accidental exposure. For example, chemotherapy waste is frequently disposed of in designated yellow containers to distinguish it from red biohazard bags. These materials must be handled according to strict environmental laws to prevent the contamination of ground soil and local water supplies. Next, we address disaster preparedness. Every healthcare facility is legally required to have a written disaster plan. As a technician, you must be familiar with your specific role within this plan, and facilities conduct regular drills to test its effectiveness. Disasters are categorized into two types, internal and external. An internal disaster is a situation occurring within the facility itself that disrupts daily operations. Common examples include a total loss of power, a steam failure that shuts down the sterilizers, a computer network crash, or a fire within the building. An external disaster is a situation occurring outside the facility that results in a massive influx of patients to the emergency room. This could be a train crash, a major earthquake, a terrorist attack, or a pandemic. During an external disaster, the role of sterile processing is critical. You may need to rapidly process turnover sets to keep up with the overwhelming demand for emergency surgeries or manage severe supply shortages. We must also be prepared for biological disasters, often associated with bioterrorism. You should be familiar with agents such as anthrax and smallpox. Your facility will have specific protocols for decontaminating instruments exposed to these agents, which often involve high-level transmission precautions or the decision to use disposable items to prevent cross-contamination entirely. We also face a specific physiological safety concern, latex allergies. Many medical supplies, including gloves, contain natural rubber latex, NRL. Reactions to latex generally fall into three categories. The first is irritant contact dermatitis. This is a common skin irritation, often caused by hand washing or the powder in gloves, but it is technically non-allergic. The second is type 4 hypersensitivity or delayed hypersensitivity. This is an allergic reaction that appears 6 to 48 hours after contact, typically presenting as itching, redness, or blisters on the skin. The third, and most dangerous, is type 1 hypersensitivity or immediate hypersensitivity. This is a severe, systemic reaction occurring immediately upon contact. Symptoms can range from hives to difficulty breathing and anaphylaxis, which is a life-threatening emergency. To ensure safety, SPDs should offer non-latex glove alternatives, such as nitrile, for all staff with sensitivities. We conclude our safety lecture by addressing the modern reality of workplace violence and the final requirements for employee training. In the healthcare setting, a zero-tolerance policy is the absolute standard. This policy covers not only physical acts of violence but also threats, harassment, and intimidation. You have the right to work in an environment free from fear. To enforce this, facilities utilize strict security measures, including badge access-only doors and specific emergency codes. For example, Code Silver is the designation commonly used to alert staff to a person with a weapon, a hostage situation, or an active shooter event. You must memorize the specific color codes used by your facility, as prompt recognition can save lives. This brings us to employee information and training. Safety training is not a one-time event that you complete during orientation and then forget. It is an ongoing legal requirement. Onboarding training must occur before a new employee starts working with any hazards. You cannot learn safety procedures by trial and error. Furthermore, specific training modules must be updated annually. Every year, you are required to review fire safety, hazardous materials, and bloodborne pathogens protocols. These updates ensure that you are aware of any changes in regulations or facility procedures. Ultimately, safety in the sterile processing department is defined by the principle of shared responsibility. The employer has a legal obligation to provide the training and the necessary equipment, known as engineering controls. However, it is legally and ethically the employee's responsibility to attend the training and use the equipment correctly. Consider this critical legal nuance. If an employer provides you with the correct personal protective equipment and trains you on how to use it, but you choose not to wear it because it is uncomfortable or you are in a hurry, and you subsequently get injured, the liability may shift from the employer to you. You cannot claim negligence if you refuse to use the safety tools provided. Therefore, safety is not just a set of rules in a manual, it is a personal and professional mindset. Whether it is ensuring a walkway is clear of clutter to prevent a colleague from tripping, or taking the extra 10 seconds to put on a face shield before entering the decontamination area, the sterile processing technician must make the conscious decision to prioritize safety every single shift. Your health, and the health of your patients, depends on it. This concludes our comprehensive study of Chapter 22, Safety for Sterile Processing.